Welcome, everyone. We are so happy you are with us. For folks who may not know, monthly, we do our She Matters webinar series. It is issues that affect Black girls and their ability to thrive and to also eradicate systemic inequities in Allegheny County, in Pittsburgh, in Pennsylvania, and beyond. We're happy to be here with you today. My name is Tashira, she, her. I am a Black woman with tortoise frames. I am bald-headed. I have dark brown skin and a Professor Oglesby blazer on today. And I have also with me some amazing, amazing panelists that we will get to in just a moment. But in the meantime, we are a sanctuary model at Gwen's Girls. And so I should start with a question. And I was chatting with Shireen and I said, stay on your toes, girl. I'm gonna have a good one this time around. So today's question, I need everybody to answer in the chat, and our panelists will answer individually, is if you were a fruit, what would you be? If you were a fruit, what would you be? Okay. I think I would be a banana. I'm tall. I'm almost 6 feet tall, y'all. So a banana seems right. I love yellow as a color. I can be soft, but I can also be a little hard. Okay. So yeah, I think a banana sounds right for me. You all let us know in the chat if you were a fruit, what would you be? And welcome to this month's She Matters webinar series. Today we're talking about going from mandated reporting to mandated supporting. And we have some amazing panelists with us once again. Let's bring up Shireen White, please. I would love to have Shireen on the virtual stage with me. Shireen, if you were a fruit, what would you be?
All right, you got me. If I was a fruit, I think I would probably be a pineapple.
Okay.
Because you gotta like in order to get to it, you gotta cut through some layers, you gotta get in there, and that's how I feel about sort of getting to know me. And also, it's really sweet, and my name actually means the sweet,
Oh,
and I think I wear that really well.
I love it. Good answer, like on a Family Feud. Good answer. Good answer. All right, Dr. Raquel Ford, to the stage. If you were a fruit, what would you be?
I'm thinking that I would be a peach.
Okay.
Because sometimes when we eat peaches, they have a firm bite when we're biting into those. But then once you get into the inside, you get the sweetness. Um, so I think that I could be firm, but then it's that part of me that you get to know me, and I could be kind and I could be sweet and nurturing to others.
I love it. There's a theme going on. Eunice, how about you? Eunice Stover's with us today.
Um, I think I picked an orange. First of all, orange is my favorite color, so I'll pick that. But almost just like what was said, you have to peel it through. You have to get to the sweet part, and that's me. I can be very reserved, and so you really got to work to get to that sweet part.
Lovely. And then we have Sarah Nevels.
So I am Sarah Nevels. I am with Gwen's Girls and Caring Connections for Youth. As far as a fruit, I would say mango because I'm round, tropical, sweet, but also very refreshing. And that pit, like in the middle, which is like somewhat toxic, I think that that's kind of at the core of part of who I am and why I am. So, yeah.
That pit's also the best part too, Sarah. I don't know about anybody else, but like growing up in Florida, that's the part I would actually want.
Mm-hmm.
So,
Yep.
okay, welcome everybody. Please keep it going in the chat. I am hearing apples, all varieties, strawberry, and other. Somebody said, now I'm hungry. Exactly. Again, our topic today is going from mandated reporting to mandated supporting. And we're going to start today with Shireen White from Children's Rights. So, Shireen, can you please tell us a bit about who you are and the organization that you're joining us from?
Yeah, thank you so much. Good afternoon, everybody. My name is Shireen. I'm the Director of Advocacy and Policy at Children's Rights. It's a national nonprofit organization that utilizes both advocacy and policy, but also litigation in order to hold government systems accountable to the health, safety, welfare of children. We are national, but based in New York City. I actually live in Pennsylvania. And I'm excited to have this conversation with all of you today.
And Sharina, I have to say that I've been a big fan of your organization's work for a long time, and I'm so happy
Thank
that we
you.
have connected.
Same.
As someone who is a former GAL, many of us on this call know that there are other systems that tend to get a lot more shine than child welfare, especially the efforts around reform and even abolition for some of us. And so, can you just start by setting the stage for us around mandated reporting? Because obviously, these laws have not always existed. And it might be helpful to just set the context for today's conversation. What's the history?
Yeah, thanks for that. I also used to be a child advocate attorney in Philadelphia, which was sort of my entry into child welfare work. And I think one of my biggest sort of regrets around that time is I really only knew like my cases and my clients, but I had no idea that there was so much happening around me in the child welfare realm. I didn't know much about legislative changes or proposals or policy and practice changes or what the conversations were. So it's been super exciting to be at Children's Rights, leading our advocacy and policy work, and to really dig into all of the important conversations in this particular area right now. And so, in the spirit of having curiosity and regaining our wonder, which I think is something we lose a little bit as adults, I appreciate the pause to sort of stop and think about where these laws even came from and how we got here. And so the short version is sort of what I'll focus on today. But back in 1962, there was a doctor named Henry Kemp, and he wrote an article that was published called The Battered Child Syndrome. And this article really sparked public interest and attention and conversations about the problem of child abuse in America. But it really didn't stop there, because the next year, in 1963, the Federal Children's Bureau, which is the national agency that oversees all child welfare agency work and the work of child welfare across states, the Children's Bureau published another article, and this paper focused on child neglect and abuse and a real increase in violence against children. And consequently, the Children's Bureau worked with a number of other organizations, including child-centered organizations, and they drafted model legislation. And in their eyes, this model legislation would fix this national problem of child abuse and violence against children. And the legislation required that doctors and medical professionals report instances of child abuse. And I think it's interesting that they focused only on doctors and medical professionals because, as referenced in the Battered Child Syndrome paper, and through their eyes, doctors would come into contact the most with children who were experiencing abuse. And so it made sense to have medical professionals be reporters. So in that same year, 1963, we saw the first state issue and enact mandated reporting laws. And then 4 years later, by 1967, all 50 states had a mandated reporting law in place. And then fast forward a little bit to 1974. So one of the biggest pieces of child welfare legislation that we operate within is the Federal Child Abuse Prevention and Treatment Act, or CAPTA. And CAPTA has many components to it. And one of those components is mandated reporting. But CAPTA wasn't enacted to provide a federal system of mandated reporting. Instead, it wanted to leave it up to the states to have their own systems of reporting. But what CAPTA did was it incentivized financially this process, procedure, and practice of mandated reporting. So under CAPTA, states are required to have provisions or procedures for an individual to report child abuse or neglect, not just abuse, but also neglect. And states are required to have named individuals who are listed as reporters. And so if you have those in your state plan, then you can collect federal funding under CAPTA. So that's sort of where the laws came from. But then we saw that over time, after the enactment of CAPTA, states really started to expand on their mandated reporting laws, even beyond what the federal legislation requires. And they expanded on the categories of reporters. So now we have every kind of medical professional that you can imagine, but also teachers and educators and education personnel, law enforcement officers, you name it. And then, as is often the case with child welfare, we get a lot of laws and policies and practice changes in response to big scandals of abuse. And I know a number of folks, and the work that you all do, Tashira, is focused in or started in Allegheny County, Pennsylvania. And in Pennsylvania, back in 2011, Jerry Sandusky, we have the Jerry Sandusky scandal, which many folks know about, and it's really related to mandated reporting shifts in the law. But he was a former coach at Penn State University, and he was charged with over 40 counts of sex abuse against young boys. And what they learned during this investigation was that many other Penn State staff and personnel, faculty, knew about or suspected this child abuse, and nobody reported. So in Pennsylvania and every other state, basically, started really digging into their mandated reporting laws and working to expand them, make them stronger. We saw a lot of efforts to implement penalties for not reporting sex abuse or child abuse or neglect. And we also saw a lot of states introduce bills, not all of them passed, but a lot of states introduced bills where it would make everybody in the state a mandated reporter. So those were universal reporting bills. So that's sort of how we've seen mandated reporting laws evolve and expand over time. And many people believe that we're continuing to see the impact of the Jerry Sandusky scandal right now.
Okay, thank you so much for laying that case, because I did not know that the year was 1963. You mentioned that the
Yeah,
book was written, and the first thing that came to my mind was Shireen, was the Moynihan Report, which I
yeah.
googled was written in 65. And so there seems to be kind of this convergence of not just attending to abuse and neglect, which is a serious issue,
Mhm,
but the criminalization of poverty and of Black
mhm.
motherhood, and how that has
Yeah.
also become the root of the modern child welfare system. So
Yeah.
thank
Yeah.
you.
And I mean, that's a good point to share, because what we know about these mandated reporting laws, and a lot of the reason why it's a big topic right now, is because these practices disproportionately impact families of color, poor families who are dealing with issues of poverty, and also families with disabilities. And so those are the folks who are experiencing this over-reporting. And it's harmful and traumatic, because that reporting leads to investigations, which can be pretty traumatic for families.
Exactly. And today we're talking about going from reporting to supporting. So
Yeah.
tell us a bit about the reform work that's been happening, and a bit more also about why this has all been so problematic for poor Black and brown families.
Yeah, I think before we talk about some of the work around the country, I want to point out one of the things that happens, I think, with some child welfare legislation is that people sort of just operate with, like, this is the law that we were handed, and this is what we have to do. And people don't stop and think about whether or not it's been effective at what it was intended to do. And there's been some research articles done around mandated reporting, and I want to highlight one, which was a publication from Child Trends, and it was published, I believe, last year in 2024, and it was an article called "Mandated Reporting Policies Do Not Promote More Accurate Reporting of Suspected Neglect." So a lot of folks hold on to the notion of mandated reporting, believing that it is what's going to keep kids safe, that reporting is going to stop child abuse, and intervene. But this article really helped us see that it's been really ineffective at identifying instances of abuse or neglect. And so I'll share some national data. I know we're going to get into some more specific Pennsylvania related data, but nationally, the scope of the problem of overreporting is so big. So each year, there are about 4 million reports of suspected child maltreatment. So that's abuse and neglect made to hotlines across the country, 4 million. Of those, 2 million meet the criteria for an investigation. So only half of those are even brought in for an investigation. And then of those 2 million, only 600,000 are substantiated. And so that means that there was a determination made that abuse or neglect did occur in only 600,000 of those original 4 million reports that are made annually. Of the 600,000 that were substantiated, 76% of those include allegations of neglect. And we know not all, but some allegations of neglect are really tied to poverty and instances of families that are lacking resources. So that's a pretty giant number of those substantiated cases that's focused on neglect and poverty. And we know that here in this country, families who experience poverty a lot of times are Black and Brown families who are lacking resources. And that traces back to all the historical sort of ties and oppression against Black and Brown families in this country. But that Child Trends report suggests that mandated reporting policies do not have the intended effect of ensuring the accurate detection of maltreatment, especially when it comes to neglect. And so as much as people want to hold on to this notion that mandated reporting is what's going to keep kids safe, detect child abuse, we're seeing more and more research that shows that that is in fact false. So around the country, we're seeing a lot of conversations happening around mandated reporting, which has been amazing. I know one of our partners, Joyce McMillan at JMAC for Families, worked with the Columbia School of Social Work. And that's sort of where this idea of mandated supporting originated. They developed sort of a process for helping folks to think about supporting instead of reporting. And that's gained some traction around the country. There have also been a number of bills that we've seen introduced and also task forces. So in a lot of states, there is this idea of anonymous reporting where people can just anonymously call the hotline and report suspected or known instances of child abuse or neglect. But data has shown that a lot of times that's used to harass folks. People are using this hotline really to retaliate against folks, and those reports are inaccurate. And so Texas, for example, passed a law in 2023 prohibiting anonymous reports of child abuse or neglect. And now when reporters call and make reports in Texas, they have to provide their name and contact information. And so the idea is that this will cut down on the number of false or harassing reports that are made. We've seen this bill pop up in other places, including New York. It has yet to pass in New York State. In terms of task forces, California had a mandated reporting task force that we've been following. They have issued a report, a long report with a lot of recommendations, and we're following to see if any bills are introduced that align with the recommendations that they've made. In Colorado, they also had a task force that was enacted by the Colorado legislature. Interestingly enough, the guy, Henry Kemp, the doctor who wrote that battered child syndrome article, there's an institution named after him in Colorado called the Kemp Center. And they've actually been doing their own work around the issue of mandated reporting, which I think is a really big deal. And they were celebrating the introduction of a bill in Colorado that follows the recommendations of the Colorado Mandatory Reporting Task Force. And that bill specifically will change reporting requirements for abuse and neglect, and including the timeline and timing for making a report, and not requiring reports when information is received outside of a person's professional capacity, and also removing victim advocates from the list of mandatory reporters. That's pretty important because we know that one of the problems of mandatory reporting is that It's difficult for families to seek help from helping professionals, feeling that they are at risk or may be at risk of child welfare system involvement or having their child removed simply for seeking help. So this bill in Colorado is seeking to reduce a category of reporting that's a really big one. So we'll see what happens and we'll continue to follow that. And then lastly, we co-facilitate at Children's Rights, the New York Mandated Reporting Working Group with JMAC for Families and a number of other organizations in New York. This working group started in 2023, and it's made up of attorneys for children, for parents, lived experts, policy people, researchers. And really, we just took time to really dig into New York's mandated reporting laws, we're understanding where they came from. And we have been thinking about a number of legislative changes. I think ultimately, many of us would like to see the mandate removed entirely. So there would still be a process for reporting, but the mandate would be eliminated and professionals would exercise judgment with their decision to report. But we know we're sort of a long ways from that. And we're rallying around a bill that was introduced earlier this year in New York, which would remove the penalties for not reporting. What we heard in our listening sessions from a number of reporters is that often they just report out of fear. And so we're hoping that this legislation will end fear-based reporting and help families and helping professionals work on building trust and get connected to resources and services that they need without having to come into the trauma and harm of the child welfare system.
Thank you for
You're
that,
welcome.
Shireen. Especially, I like this context of fear-based reporting, because what that says to me is that under the current kind of regime and system of laws, depending on the state and jurisdiction in this country, many folks might be reporting and over-reporting out of fear for themselves,
Yeah,
lawsuits, job security, et cetera, not actual fear of what's happening to that child.
that's right.
And those are two markedly different things.
That's exactly right.
So you all, please feel free to drop any questions for Shireen about her work and the work that's happening at Children's Rights and around the country in the chat. We will circle back around to her in just a moment. Oh, 1 second. Cindy has a question. Love the idea of mandated supporting versus mandated reporting. What might the former look like and include? Are there any states moving towards this?
Yeah, I think that's the idea behind, these task forces and the legislation that's been introduced, is that we understand how harmful the system can be for folks, and also that caseworkers and child welfare systems are really overburdened by the over-reporting of cases that don't belong there, right? And so it's really hard to focus and zero in on cases of real abuse when you have so many people being connected to child welfare systems for just getting connected to resources and where there's not harm taking place. And so I think there are many elements to this idea of mandated supporting. It's to help people think about what resources are available in their communities where families can be connected and will actually receive the help that they need and that they require. And a huge part of that is developing cash assistance pilots across states. And so we're seeing those pop up in places, and we hope to see more of those so that people can be connected with cash assistance.
Absolutely. Thank you for that reminder, Shireen. We'll circle back to you in just one moment.
Yeah.
We are going to bring Dr. Raquel and Eunice up to the virtual stage. And Dr. Raquel, please introduce yourself for the webinar. We'll start with you, then we'll go to Eunice.
Good afternoon, beautiful people. I am Dr. Raquel Ford. I am a casework supervisor at Allegheny County Children, Youth, and Families, and also a co-convener of the mandated reporting group with the Gwinsboro Black Equity Alliance.
Hi, I'm Eunice Stover. I am a regional office director at CYF. I've been with the agency for 26 years, and I'm also part of the work group action team for child welfare with Gwen's Girls.
Thank you both for all of the work that you do in the county and also with the Black Girls Equity Alliance. Much of the way that this work group or now action team has formed has been under your leadership, taking us from kind of child welfare writ large and now to this focus on mandated reporting and most importantly, supporting. And so we're going to look to you to be our local experts today. Can you please first just situate for us what we know about what is happening in Pittsburgh, Allegheny County, and how much of what Shireen just mentioned actually affects us here? Now I'll kick it off to Eunice or Dr. Raquel, whoever wants to start.
Ms. Shireen had already stated a little bit about what's happening here as well as nationally, is that it is Black children are being disproportionately referred to children, youth, and families more often than any other race. Here in Allegheny County, the Black child has been investigated 5 times higher than white children that have been referred to CYF. So just imagine how many times our children are touching the system, usually for reasons that are not child welfare related. And so what we want is with this work is just for people to stop and think, is this child welfare related? What is the need of the family? And can that need be met without involving the child welfare system? I don't know if you want to add anything else, Raquel.
You know, I was thinking about, so we're just talking about they're referred for, they're investigated 5 times more, but then they are accepted for a case 2 times more. And that means that there's ongoing services with child welfare. So once they come into the system, it is very, very hard for a family to get out of the system. It's easy to make a report, but it's so much harder to get out of the system once you come to the attention of a child welfare agency, because now we're going to become really invasive in your life and start investigating every aspect of it, down to what's in your refrigerator, how many times your child has gone to the doctor, is your child receiving their immunizations? And it may be something like a religious reason that children aren't getting immunizations, and someone may say, well, that's a child welfare issue to me. So really we become really invasive, and it's really hard for us to move on through the system, because once people find out a family is involved in child welfare, we get calls after calls after call. I don't know if you have anything more to add to that, Eunice?
And again, like what was stated nationally, as well as here in Allegheny County, we receive hundreds of reports, and pretty much 20% are screened out because they're not child welfare related. And again, we have to look at how many cases our caseworkers are carrying. These cases that do seem to make it into investigation, those caseworkers have to keep those for 60 days. So even though we may have we have to do all those checks. Are they medically up to date? Are they attending school? We have to do all this background work before we can even close that case. And it came to our attention because there was a need that really was not child welfare related.
Mm-hmm. Absolutely.
So I'm going to pull up for you all the implicit bias questionnaire that we created just to have you all walk through for our audience in case that is helpful.
So I know that we may have, before we get into this, we may have used some foreign language for people when we talked about referred, investigated, and cases. So when you have a family come to the attention of a child welfare system, that's what we call a referral. That means a call was made to the child line department, and now it's going to be referred to the proper agency for what county that a person lives in. So that's when it could be, it could be referred out. Like, there's nothing, this is not a CYF issue, this is not a child welfare issue, or it could come in because of some of the thresholds it's meeting. It don't always have to say that it's not a child welfare issue, but if it meets certain thresholds, then we'll get the call anyway. So then that's when we get to the investigation stage. And as Eunice had said, the investigation stage can last up to 60 days. So we have 60 days to make a decision on to whether accept a family for ongoing services or to close a family out because they have the it has been lowered. The risk has been lowered on a family, or there wasn't anything that needed to be further intervened with by the child welfare system. And then we talk about cases. Cases is when a family has ongoing services with us. That's when we are ultimately looking for permanency for a child, trying to lower the reason that the family came in, no longer being able to no longer having to intervene with the family's life. Like, what does it look like to have stability, to have permanency for these children? And then we close out. So I didn't want the language to sound foreign that we're using to you. I really wanted you to all understand the process that we go through as we are navigating families coming into the child welfare system. So in front of you, on your screen, you see the mandated reporter implicit bias questions. These questions are questions that we came up with as a group because of the number of things that Shireen has talked about, that Eunice and I have talked about, just to really help people to understand why they are making a report to the child welfare system by just asking themselves these 5 questions that you have in front of you. So, what is the allegation or concerning behaviors? What do I see in front of me? Why is this family's, what in this family's life is being impacted that I feel that there is a need for a child welfare intervention for this family?
And the next one is my concern rooted in poverty or neglect? We've talked a lot about that today. A child not having glasses, a child having inappropriate clothing, those things can be addressed outside of the child welfare system just by making a call to a social service agency in the area. So again, we have to look at why we're calling. Is this truly physical neglect, or is this something that is poverty driven?
Right. And then, can my concern be mitigated by providing the family with resources? I know here in Allegheny County, where we all live, there is a lot of resources out there that families can go to get the services that they need. So, just really knowing what is there to offer these families and simply asking the question, is there a service that this family can have? Like, just you doing a quick Google search, for a family, or asking a colleague, have you heard of a service that can help a family with this? If this child comes to school with flip-flops in a winter storm, what's the need there? Is this a safety concern, or is this my problem with the child coming to school with a pair of flip-flops? Is this a poverty concern? Is this something that a resource can offer this family? Can a resource provide this family with a pair of boots, with a coat for this child? So really knowing what's out there and not causing trauma to a family by referring them to the child welfare system, because again, once the child welfare system becomes involved with a family, it's really hard to get them out, and the child welfare system can be really invasive to families, and we don't want that for a family who don't have to go through that.
And the next one is very difficult. Some of us may have trouble swallowing this one, but have I checked my implicit bias or privilege? What are we looking at when we're making this report? Do they not live how I live? Are their clothing not appropriate because I feel their clothing is not appropriate? We have to look within ourselves to say, are we using our standards on these families that we're reporting? So again, we have to look at the circumstance. What language are we using? Do we think that they should be parented differently? Because that's not how we were parented. So we really have to check our own selves to see why we are making this report right now.
Mhm. So this must be my favorite question. Question number 5. What is the best outcome for the child and family? What do I ultimately want to happen for this family? Do I want this child to be caused trauma? Because we know from research that a brief interaction with the child welfare system can provide a long-term traumatic effect on a family. So these families may no longer respect respect agencies, or they may not want to be cooperative because of the things that has led them to the child welfare system. So asking myself, what do I want to happen? What outcome do I want for this child? Do I want this child to have trauma? Do I want this child to be able to have a coat? Do I want this child to have clothes that fits them the way that I believe that these clothes should fit them? What is it that I ultimately want for this child? So really understanding what outcome you want for the child, and really, really, really digging into the resources that has been allotted to you through your community resources.
And it's very important that you focus on that when you're making your report. This is what is happening, being very specific. This is what's happening, and this is the outcome that we would like to see for this family. Again, we want to be sure that we are addressing the family's need and that it is child welfare related.
Thank you both for that. I know there are resources that we've been trying to put into the chat for you all. They are PDFs, and right now Zoom is giving us the blues. And so if we can't get you that one pager or the resources that Shireen mentioned during her discussion, we'll make sure you get those via email. But I'm going to bring Shireen back up as well. Because Shireen, we would love to just hear your reactions and how some of those questions might line up with the work that you've seen across the country on this issue.
Yeah, I think the pause is sort of the most important thing, for people to just sort of stop and think about what they're doing and like put themselves aside and actually focus in on the children that are at the center of these calls, and really think about, is there another alternative? And I don't think that like that has happened often, but that idea of mandated supporting is helping to shift people's attitudes and ideas around what they're doing. And you know, a lot of these people are in helping professionals, and we want them to be able to help folks and not think, let me just call CPS and CPS will do it, you know, because a lot of times people don't get what they need through CPS, and CPS isn't the right avenue for some of those needs of families. So I think, you know, these questions really invoke this idea of pausing and centering children and their families before you take action. And I think that's critically important.
Thank you for that. And we'll circle back around with you all. I do want to bring Sarah Nevels up to the stage, because when we talk about pausing and thinking about resources, the work that we are doing through Caring Connections is the pre-arrest diversion project. While we thought, I think, Sarah, right, of a juvenile justice intervention, it permeates all systems.
Right.
So please tell us about Caring Connections and how this work kind of can address some of the issues that we talked about today.
So first, I want to say thank you very much for allowing us to be a part of this conversation. Shireen, Eunice, and Dr. Ford did a really good job of talking about the disparities, the statistics, and what we know we see in the system, and really putting a face to it. But we know that there are drastically different outcomes for Black and Brown families in the system. And when I say the system, I mean the education system, child protective, as well as juvenile justice. When Caring Connections was initially created, it was about interrupting the school to prison pipeline and really getting in front of families before young people get into the juvenile justice system. But we found so many intersections, and we also found that it was very needed and necessary to get in front of young people and families before they interact with the child protective services system as well. We know that Black and Brown families and young people don't thrive necessarily when there's system involved. They will thrive and do better and have better outcomes if we can create community-based initiatives to really provide substantial supports and services. But also what happens then is they're more connected. Families are more connected, young people are more connected. They're connected in their own space with people who look like them, people who are in the same trenches, so to speak, and are understanding the issues that they are facing, and not a system, right? So they're more connected, it's a deeper connection, and it's a more relevant connection when it can be a community-based serving instead of a system. So kind of where we fit in is into number 3, which is that mitigating by providing resources. So can we mitigate the circumstances or situations that has brought a concern, right? And can we provide some resources and connect the family in the right places and create access to all of the wonderful supports that are here in Allegheny County for a family without system involvement? And then also, can we have better outcomes for children? So, and that's number 5. So what Caring Connections for Youth it is an initiative of Gwen's Girls, but it is not just for girls. It is for all youth, again, all youth in Allegheny County under the age of 18. It is a 24-hour hotline that you can call using United Way's 211 option number 3, or you can connect to us, and I have it in my background, but you can connect to us through Gwen's Girls website, the Caring Connections for Youth website, which is cc4youth.org, as well as on United Way's website. You can direct call us, you can chat now, text now, all of those features. We also have a QR code. But what happens and anyone can refer to us, a family themselves, a grandmother, an auntie, a teacher, law enforcement, caseworkers, any youth serving agencies, anyone can refer to us. And what happens is we work very closely with the young person and the family to look at, what do you feel your family needs to be successful? Not what does everybody say you need to fix, but what do you feel like you could use some support with? What does support even look like for you? What are the strengths in your family? What are those areas that you would, again, like some additional support in? What does success look like for you and your family? Not what does success look like for my family, but what does it look like for you and your family? And then what are the things that you've tried in the past? What has worked? What has not? And then we do a lot of conversation about what are the barriers. For example, if you say to me that you need therapy and you would like your young person to be in therapy, and I find you this great therapist out in South Hills and you live in Homewood, there could be 2 problems there. One, that therapist may not look like you and may not be culturally responsive to the things that are impacting you on a daily basis. And also, you may have to get 3 buses to get to that therapist. That is not relevant for you. That is not realistic. That is really not truly accessible for you. And it's not necessarily going to help you. So really talking about, again, what are the barriers? What does help look like for you? And not always looking at traditional things. Sometimes we have to look at very non-traditional grassroots things that maybe don't have a brick and mortar building or a tax ID number, but could nonetheless be a resource, like a coach, a little league football. All of those things can be great resources that aren't necessarily considered traditional resources. So really trying to be unique in our approach and working alongside with families, not fixing families. But that's really what Caring Connections for Youth is. And again, it is designed to interrupt system involvement for young people and youth, as well as families in Allegheny County.
Thank you, Sarah. And then Shreen dropped in the chat. Looks like Miana has answered whether the people who take the calls at Caring Connections are mandated reporters and how you all weave that into your work.
Yes, yeah, of course. Gwen's Girls, all of our staff is mandated reporters. We do what we need to do. We don't ever make reports without talking to a family, and we typically make reports with a family so that you can hear everything we're saying and you can be a part of everything we're saying. But we also very much look at, is this really a mandated reporting issue? Or can we put some supports in place and support this family? Some of it is, I know better when I do better. Or I'm sorry, I do better when I know better. And some of it is maybe just a family not realizing, or maybe a family not having the skills or alternatives, but really working with families to look at that. But, if it is a safety issue, it's a safety issue.
Yeah, yeah. I don't think anyone here is denying when that does occur. That's the
But
thing.
also we can have a co-response, right? We can say, yes, we have to involve CYF. Yes, this is a mandated issue. We do have to contact, but we can help you so that it's not as impactful or negatively impactful. And we can help you navigate all these systems in a way that truly supports you and not just leaves you out on your own.
Thank you, Sarah, and thank you for bringing the Caring Connections work to the forefront as an example of ways to connect folks in community to resources that might be much needed. Amy, can you bring everyone back up for our Q&A? If you all have questions or thoughts, please drop them in the chat. I know as we were preparing for the webinar, we had a conversation about predictive analytics, and it looks like Cindy has mentioned that. She says, excellent point that once a child family's in the system, it's hard to get out that system. There's some really good data that a tool developed and used in Allegheny County reinforces racist and socioeconomic, I'm imagining, biases. And so, Dr. Raquel and Eunice, it looks like she's pointing to predictive analytics. What say you? Not that you can speak on behalf of the entire system from your vantage point, but we have to ask the question, of course.
So that always has been a discussion since that has come up. And that's one of the reasons we are looking at this mandated supporting. If we cannot get them to touch the system, then that tool cannot be used against them later. Because what happens is the more reports they get, the more it's likely that they will go into the system. So what we want to do is prevent that from happening. And just to let you know, we do have the ability to not use that tool. So we do allow some of our supervisors in our intake department to override that tool. Again, if we see that this is not a child welfare related report, and even though that score is saying this family should be investigated, we do have the ability to override that.
Thank you for letting us know that, Eunice. And I'm actually going to drop in the chat as well for everyone. Thank you, Amy, for putting all of the resources that we talked about in a Google Drive, just as a workaround to the chat feature. So if you all want to click that before we wrap today, you will have access to the PDFs. As you all were talking, one of the things that I thought to myself was, in order for the outcome to occur that we are all seeking to happen, we have to stop seeing poverty as a choice. Because I would imagine that if I, as a parent, am coming, sending my child to school, it's cold and my child doesn't have a coat, there are teachers, administrators, reporters in the building who would say, I can't believe she would send her child to school without a coat. How dare, this is why they don't need to be having, we know the rhetoric, right? We know the ways in which, especially for me as a Black female bodied person, how I would be drugged as a result of that. But there are so many complicating factors that could go into it, some of which we talked about today. So how do we get to that root, especially under the current conditions that we are attempting to organize in right now, sociopolitically? Small question, if anybody has a thought.
I'll just start with, again, you have to stop and pause. Stop and pause. Have a conversation. Here at CYF, we have what's called a staffing. We don't make a decision with just one person. Maybe get some other opinions. Maybe have another staff person that's used to dealing with this child and have a conversation on whether this really needs to be a report to child welfare. How can we help this child without involving them in the system?
Like really knowing what is allotted to you out there. Like, do we need to intervene in this kind of way? And that's why I said, always asking that question. What outcome do I want for this child? That's again a pause, like really thinking like, what is it that I would like to happen for this child? Or even putting yourself in their shoes. If this was my child, what would I want for my child in this case? So, you just have to have a holistic perspective of what you want for this child and knowing what is out there, really learning, really using your resources or having an accountability partner to check you on your thought process, really checking those biases because we all have them and sometimes they come out to play. So really knowing those things and not putting our own belief and value system on someone else, but asking ourselves ultimately, what is it that we want to happen?
Thank you for that, Raquel and Eunice. Any other questions from the chat, resources that you all might have to share? We would love to hear from you. In the meantime, I would love to ask questions about legislation and the role that that plays in all of this, because Shireen, it wasn't lost on me when you mentioned by transforming or eliminating the current laws, it does not mean people won't still report or still be expected to report, right? It's just what is currently on the books is actually providing an adverse outcome. So, what do we think about current legislative efforts right now? Will we ever get to something happening on the national level? What's next?
Yeah, I think it's so important to challenge the policies that we know are ineffective, don't make sense, are harmful, and to actually do something about it. And it's really encouraging when, for example, we can say in other places, well, Allegheny County is doing the work of mandated supporting. Let's help them have their laws back that up and support that, right? Or, in other states, we can encourage child welfare agencies to start this conversation, to do this work. And then that will sort of be like breathing ground for legislative movement and narrative change in the state. And the same thing with like professionals, right? Like that will be a barrier, I think, to some of the mandated reporting legislation. But when you have doctors saying, here's the problem with mandated reporting, right? And like helping other doctors to see the issue, and the same for educators, like that's really helpful. And like then a movement starts to grow and people can really together think about what legislative and policy change looks like. There was a group that started in New York but is now pretty national, Mandated Reporters Against Mandated Reporting. That's so powerful for legislative change, to hear from families who are the subject reports and also the reporters who are required to report. And so I think like as we have these conversations and share with other groups like ours about the work that we're doing, it's motivating to others to sort of do that work. And it's the local work that helps the federal work and policy change, practice changes grow, right? When we go to Capitol Hill, to be able to say, here is how Texas is shifting mandated reporting laws. Here's what New York is doing. Here's what Pennsylvania is looking at. Once they hear these stories of like the local work, then that sort of motivates the changes on the federal level. But states shouldn't be stopped right now because many of the state mandated reporting laws are far more expansive than what the federal law requires. And so states should not feel hesitant to get moving.
Oh, interesting. I also do some work around kinship care, and the same thing is true around kinship licensing.
Yeah,
Like
that's right.
what the feds require and what states require.
It's so much more restrictive.
It's like, girl.
Yeah.
It just goes back to this patent like disregard
Yeah.
for Black and brown families and Black and brown communities. It is the
Yeah.
comfort with over surveillance and over policing, and
Yeah.
it is part of every institution we have in this country.
Yeah.
And how many mandated reporting policies are so outdated now?
So outdated.
Many of the systems here in Allegheny County you talk, I mean, that was written decades ago.
Yeah.
When do we bring that up to today?
Yeah.
Point. You all, a round of last thoughts for me, please. We're going to start with you, Sarah.
Before calling, please call 211 option number 3 or check out our website. And again, even before you see a safety concern, when you see families struggling, when you hear that families are having a hard time meeting basic needs, are having a hard time with children's behavior, when kids are missing school, before it even gets to an actual safety concern, access those resources, connect families, utilize things like Caring Connections for Youth.
Dr. Raquel and Eunice.
You want to go?
I like to use the line, stop and pause before you make that call. Why are you calling? How can this be mitigated? Can we connect them to a resource that can help them without involving the system?
And I believe that in most systems, there may be a social worker working within their system. So just going to that person and saying, what do we have? This is the situation that I see. What do we have that we could offer this family? is this actually child abuse that we're reporting, or is it something that is embedded in poverty and neglect? So really asking yourself, asking someone else that, like the social worker that you may work with at your organization, or someone who you know that knows all the resources in the land. It don't even have to necessarily be someone who work in your organization. It may be that person, that leader in the community that know how to make things happen for families. So really just knowing who the right people are that you could ask these questions, and also checking yourself. We have to learn to check ourselves. Is this my problem with this family? Or is this something that is really hurting this family that I need to make a referral to child welfare that may cause trauma to this family? Because ultimately, we don't want the families to have to live through traumas of systems if they are not, if they don't have to. So we really need to be able to provide the solutions to what our problems are with someone else, and checking ourselves and asking ourselves ultimately, what is it that I want to happen for this family?
Good point. Shireen.
Thank you. I think we won't see change if there is no action. And everybody who is a part of this conversation can play a role and take some action. So, if there are not enough conversations about the harms of the system or mandated reporting laws where you are, start those conversations. It doesn't take much to host and have a town hall. You can invite lots of people in. There are lots of sort of experts in this work and people doing this work around the country. And so I just encourage people to take action, whatever that might look like for you. Like I said, we're a national organization and we're happy to share what we've learned from around the country if you're trying to motivate some legislative change in your jurisdiction. So I think there's something for everybody to do, whether it's writing op-eds and really talking about the truth of what you know and experience and have seen, whether it's sharing with other agencies for Allegheny County agency folks or other doctors, other educators, but really just start having the conversations, and then you will hopefully see some change take shape from there.
Thank you for those marching orders, Shireen. Raquel already said I love the idea of a town hall. I do too, Raquel. I really
Me
do.
too.
And spreading the gospel. Thank you, Eunice,
Yeah.
far and wide for sure. I stand by the fact that I think too much of our organizing efforts in child welfare are done in the shadows, and people do not have a level of awareness around the harms that are caused by the family policing system. And that is what we want to change and what we're talking about today. And so thank you all so much for joining us. I am going to share one more time the Google Drive that has all of the resources there. Shireen, how can people find you? I think folks know how to find Dr. Raquel, Eunice, and myself and Sarah, but what about you?
Yeah, I'm just going to put my email address
Thank you.
in the chat, and feel free to reach out at any time. I'm happy to talk further.
Okay, swhite@childrensrights.org. This webinar will go up on YouTube. We will follow up with an email as well. Stay tuned for our next She Matters series, and we will see you all soon. Thank you so much. Take
Thanks
good
for
care.
hosting this.
Thank you.
Bye.